Hello, welcome once again to our channel. Today we are going to look at what are the laboratory tests that can be done on a pregnant mother. If a mother is pregnant, laboratory testing is very important because it can help identify high-risk situations very early, and of course management or treatment can be done. So we shall begin with the commonest laboratory tests that can be done, and the first test we shall look at is the test for HIV. Now, when we are talking about testing for HIV, we should really look at it in detail here. You realize that there are two types of HIV. There's HIV type 1 and HIV type 2. Now, there are tests that can be done according to the hospital you've gone to, but the commonest test is the one known as the determine test, and then also we have one whereby they test using what we call the stat packs, and then confirmation is done by the Unigold. And in bigger hospitals they also do tests using what we call the PCR machine, also known as the polymerase chain reaction. Now, we don't need to go into all the details and all the names and then everything, but we need to get the basics. A pregnant mother should have an HIV test. The main reason is prevention of mother to child transmission of HIV is very important, because there are high chances that if at all a mother didn't know her status, her HIV status, she can easily pass this HIV to the child. So the first test is HIV, and the main reason is to prevent the transmission of HIV from the mother to the child. Of course, if at all we talk about testing, it doesn't mean that the results are going to be positive. No, they could come out when they are negative, and in this case, counseling and advice is done. We also advise pregnant mothers to bring in their male partners, their husbands, so that they also test, because there are cases of discordancy whereby the man is maybe having HIV and the woman is okay. So to prevent further transmission of the HIV, we always advise that the male partners need to be involved. We've been looking at the tests done on a pregnant mother, and we've started with the one which is so common, the HIV test. We shall go to the next test, and it is the one we call the test for malaria, also known as the blood slide for malaria parasites test. It's very important for pregnant mothers to be tested for malaria, because malaria tends to actually affect many pregnant mothers, more especially in our areas, like in Uganda, in Africa, and most of the areas where malaria is. So it's always advisable that pregnant mothers be checked for malaria. The next test is also known as the CBC, or the complete blood count test. Now, when we are talking about the complete blood count, complete means everything. So it is a test that looks at all the blood cells in the body, and more specifically we shall simplify this test by looking at the 3 parameters. And the first parameter is the white blood cell count, the next is the red blood cell count, and then of course lastly the platelet count. Thanks a lot for staying with me on this channel today, and we are going to advise that all pregnant mothers need to be checked for HIV. They also need to be checked for malaria, and then the complete blood count test. Not forgetting the blood grouping test, whereby the blood group of the mother is assessed. This is also advised. And then of course, please remember to always talk to your doctor, talk to your gynecologist, so that they can add on more tests. But the ones I've just looked at are the key tests that are advised. But please always consult your doctor, consult your gynecologist, so that more tests can be added on, more specialized care can be given. Have yourself a fantastic day. Remember to like and subscribe to our channel, and let me answer all your questions down below in the comments, and have yourself a fantastic day. Bye bye.